Hey everybody, today we're going to be talking about understanding the role of social norms and individual collective appeals in sexually transmitted infection testing behavior involving mobile health apps. So, one could argue that the largest contribution that public health campaigns play is engaging patients to participate in behaviors that will either prevent negative health outcomes or increase the probability of achieving a positive health outcome. So to understand and influence patient behavior, public health professionals must put on a marketing lens to look at patients as consumers, because patients are the largest consumers of health products and services. So it's really necessary for healthcare professionals to see themselves as marketers of health and to really shift their focus and put on this lens so that providers can better motivate patients to participate in beneficial health behaviors and minimize the patient's concerns. Sexual health is a specific area within the public health domain. It's defined by the World Health Organization as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. The World Health Organization further explains that it also is involving a positive approach to sexuality and sexual relationships, as well as the rights of all persons demanding respect and protection. Unfortunately, not all patients possess the most optimum sexual health due to negative stigma that surrounds this topic and the difficulties in changing sexual behavior. There has been a call for a broader research perspective in understanding sexual health care seeking behavior that focuses not only on how accessible sexual health services are, but what factors are driving the uptake or lack of uptake in these services. And so a next component is sexually transmitted infections, which is what we're going to be predominantly talking about the rest of this presentation. Also, you'll see them as STIs. So they're diseases passed from person to person through bodily fluids, normally through sexual contact. However, they can be transmitted during pregnancy, childbirth, or breastfeeding. STIs, they spread rampantly, and if left untreated can lead to detrimental outcomes such as infertility, chronic pelvic pain, cancer, and even death. Mississippi has the highest rate of sexually transmitted infections in the United States. Mississippi is number 1 for gonorrhea, number 2 for chlamydia, and number 5 for primary and secondary syphilis in the country. And while the rates of sexually transmitted infections spiked during the COVID-19 pandemic, testing actually decreased due to the disruptions in health care services. And so a study done by Stanford et al. Found that certain socio-demographic populations were more likely to seek sexually transmitted infection testing from an emergency department, which was previously a completely overlooked location for STI testing and education before the pandemic hit. So this study really showed the ever-evolving healthcare landscape and that there are always new ways that patients are seeking and consuming healthcare services. Digital health technologies such as mobile health apps are another example of a dynamic healthcare system. Mobile health apps, they do lack FDA regulatory control, and they have inundated the healthcare sphere and remain a new way for consumers to access healthcare information and services. So the new mobile health apps that have launched in recent years claim to detect sexually transmitted diseases and even cancer using a camera on a mobile device to scan the infected area. And then for a small fee, the app integrates artificial intelligence to provide an analysis of the scan to tell the participant that they are either in the clear or that they should seek medical help for a diagnosis. And these health apps, they were provided to bring a private and destigmatized way for individuals to test for sexually transmitted infections. However, there are concerns over the safety, accuracy, and privacy of the information collected on these platforms. And it is important for healthcare professionals and educators to know how are patients using the apps, how are they consuming the information, how are they using the services, are they using the services, and it's really just unknown how likely patients are to actually use these apps, because previous literature really just talked about the hypothetical apps. They had not launched yet, and they really were focusing more so on the conveniences of it more than the actual intention to use them. And so just seeing more of these underlying mechanisms and approaches would be really beneficial here. And so this is one of the apps. It's called HeHealth. This is probably the most predominant one, but basically you can download the app, answer a few questions about your symptoms and history, upload a photo, take a photo, and then you'll get your results for it's $9.99. So social norms, they are a major factor in patients' intention to change behavior and the actual behavior itself. There are two main categories of social norms. There's descriptive social norms and injective social norms. Descriptive social norms refer to how most people behave in a situation, and they're pertinent to consumers when faced with new or uncertain situations. On the other hand, injunctive social norms provide information highlighting what other people think people should do or what they approve of. And the stigma surrounding sexual health and sexually transmitted infections often leads to patients having a negative perception of social norms and attitudes towards engaging in behavior to optimize their sexual health for fear of shame. And these social norms can vary in different age groups, genders, sociodemographic populations, and even in geographical regions, especially in sexual health and sexually transmitted infections. And even on universities itself, you can't make the blanket statement that all universities have this social norm, because it's not true. On some universities, some people see screening for sexually transmitted infections as a positive and a way to support their friends and as just an overall beneficial influence, while on other universities it's a negative social norm, negative perception. They're fearing judgment if they're seen at a clinic, and so there's just a whole range of social norms that can be seen. And this was a good visual. This was from a study done in Greenland, and it's sort of more of a conceptual look at it, but it just visually shows you how complex the influences are, and there is clear delineations and divisions between sort of the bigger groups. However, there's a lot of overlap as well, so it's just a really complex, sort of messy health area. So you might remember this table from class. So this is Hofstede's cultural value dimensions, and they include the individual, collectivism, power distance, uncertainty avoidance, and masculinity, femininity, to understand what individuals value and how this affects their role in society. So the individualism and collectivism was defined as the degree to which people in a country prefer to act as individuals rather than members of groups. And so now I'm going to move on to the next slide. So this provides a little bit more of definitions between these two, because this is the dimension that I'm going to be using in my study and talking about. But there are three ways that these approaches are studied. The first started with Hofstede as two frameworks on a continuum, and then further research divided them into two separate dimensions, and then a little bit later on in research they split these into vertical and horizontal sub-dimensions. And in the study, I'm using these as two constructs, as two separate dimensions here. And the individual and collective appeal, it's been widely studied in the marketing literature, and it's even been studied in the public health sphere. It's really been studied in engagement in risky health behaviors such as smoking, drinking alcohol, and unprotected sex. And it has not been used widely in the intention to seek testing for sexually transmitted infections, specifically from a mobile health app. And so I think that it would just be really beneficial to know, are there certain messaging and appeals that you can use to help increase or decrease this behavior, or to help you just understand more of what matters to the patients that are using these services. And so for the purposes of my study, to better understand what influences consumers to use a mobile health app for detecting sexually transmitted infections, the individual approach will focus on how untreated sexually transmitted symptoms affect just the self or the individual, whereas the collective approach will focus on how untreated sexually transmitted infections, the effect that it has on the population. And so overall, my question, how do social norms and individual collective dimensions affect the likeliness to use a mobile health app to detect sexually transmitted infections? I hypothesize that messaging that conveys the individual level factor and the descriptive social norm will result in the highest likelihood of using the mobile health app to detect sexually transmitted infections among undergraduate students. And so using undergraduate students at the University of Mississippi, a survey on Qualtrics, it's 4 different vignettes that all compose the common symptoms of sexually transmitted infections. Two of them have the individual appeal, 2 of the vignettes have the collective appeal, and then they all have a description of the mobile health app, and then 2 of them contain the social norm appeal, 2 of them do not contain it. And so since this is a sensitive topic, I gave the students at the beginning the option. I let them know that this survey would be talking about sexually transmitted infections, and I gave them the option to yes, continue, or no, to opt out. But once they clicked yes, they were randomized to one of these 4 different vignettes, and then at the end, everybody received the same questions. And so this is just a visual flow of the survey. And so here's just an example. We'll go through all 4 of them, but I'm not going to read them all out to you guys. But I wanted to just sort of show you I highlighted where they differ, but everything in the brown or black font that remained the same throughout every single vignette. So this was the individual no social norm. So this is talking about how the untreated sexually transmitted infections are really affecting the individual and their life and health outcomes. This was the collective approach with no social norm. So this is focused on how it's affecting others and the need to prevent the spread to help others. This one is once again an individual approach, but the social norm context in this is 1,700 students at Ole Miss have benefited from using the mobile app over the past year. So that was sort of the social norm messaging that other people are doing it and using it. They wouldn't be alone in this. And same for this one. So the results, a between subjects ANOVA, a 2x2. So using the social norm appeal with 2 levels, and then that level of self-appeal, the individual or collected. And the results were not significant. None of my results were significant. But so, this suggests that including the descriptive social norm messaging doesn't affect the likelihood of students using a mobile health app to detect for sexually transmitted infections, and neither does differing the individual versus collective messaging, unfortunately. And then here is a visual if you like to, this makes a little bit more sense to you, but as you can see, it's all very, very close. They're all relatively the same. And something interesting, the closest, I guess, to a significant result was including their previous sexually transmitted infection test history. And so including this in a mixed design ANOVA, a 2x2x3, because when I asked them the question of if had they ever been previously tested for a sexually transmitted infection, I gave them the option of yes, no, or prefer not to answer. and the result was still not significant. However, on the variable for their previous sexually transmitted infection test history, the p-value was 0.051. So, can't assume anything, but would like to see a little bit more further research into this. And here are just some descriptive statistics. So I asked everybody if they believed they had a sexually transmitted infection, how likely would you be to get tested for the STI in general, and then how likely would you be to use the mobile app, which is on the right. And so these just really, really differed. Everybody was extremely likely to get tested, but then to use the mobile app, these responses varied. And I was expecting this generation, I think, to be a little bit more open to using the mobile app just because they are so used to technology. However, these were probably the results that the responses I also would have given. I probably would have been also extremely unlikely or somewhat unlikely as well. And so the results of the study not reaching significance, this just indicates I can't rely solely on the individual or collective message appeals or the social norm appeals to understand what influences the student's likeliness to use the mobile health apps to detect for sexually transmitted infections. And so nothing was significant, but I do still think that there is a need to understand more of how the mobile health apps and digital health technologies are affecting, and I definitely think it's good to leverage these technologies. And so like what the app developers are trying to do, I think that it's good. However, I also just see that there could be a lot of negative outcomes that come from this, especially related to privacy and data leaks and just having AI and an app scan you, and then people, if they get the message that they're clear, and then not going and seeking further testing because I could just see this being really discombobulated too. But I do think it's good to know if people are going to use the apps. I think healthcare providers, policymakers, marketers, everybody needs to know how consumers are going to be using the apps, and are they going to use them, and how are they going to use them. And so overall, sexual health seeking behavior is complex, but was really, really interesting. So thank y'all. If y'all have any questions, just please email me or text me.